Hospitals in India are reporting a rise in the number of COVID patients suffering from a secondary black fungus infection, with over 200 such cases reported across the country. The fungal infection called mucormycosis is caused by a group of molds called mucormycetes that are present in the air and cause complications in those with acute illnesses such as severe COVID or in people with compromised immunity. According to doctors, once inhaled, the infection in such patients could spread into the sinus cavities, lungs, and chest cavities. Why steroids and COVID-19 increase the risk of black fungus for people with diabetes, in general, are slightly immunocompromised because elevated blood sugar impairs the immune system. If diabetics get an infection, then these patients are more likely to have trouble to fight off the infection. Diabetics have high blood sugar levels too, which is an environment fungus thrives on. Sugar feeds the fungus, and then the fungus is stronger than immune system that is trying to fight it off. Deadly black funguses in India. Facts about mucormycosis in COVID-19 patients. In India, Odisha has detected its first case of mucormycosis, or black funguses, in a 71-year-old COVID-19 patient with a known history of uncontrolled diabetes. Let's take a look at some facts about mucormycosis, also known as the black funguses infection. 1. Black funguses is caused by a fungus named mucor, which is found on wet surfaces. 2. Mucormycosis, to a large extent, is happening to people who have diabetes. It is very uncommon in those who are not diabetic. 3. Cases of mucormycosis is causing blindness or other serious issues. 4. This disease is not new, but is on the rise among COVID patients because the use of steroids elevates sugar level and some medicines suppress the patient's immunity. 5. The black funguses is present in the environment, and those with suppressed immunity or co-morbidities are more vulnerable to this infection. 6. Symptoms of mucormycosis include headache, fever, pain under the eyes, nasal or sinus congestion, and partial loss of vision. 7. The treatment involves injections for 21 days. 8. This fungal infection came to light during the first wave of the pandemic. Conditions like HIV/AIDS, uncontrolled diabetes, mellitus, cancers, organ transplant, long-term corticosteroid, and immunosuppressive therapy increase the risk of this disease and the predisposing factor for most of the cases prior to the COVID-19 pandemic.